teeth orthodontists are actually damaging your face. It's a claim that's long been made by English orthodontist John Muir, and for that he's been labelled a maverick by others in the industry. But there are now general dentists in New Zealand supporting him and offering his alternative treatment called Orthotropics. Those who offer the method claim they too are being ostracised by an outdated industry who aren't making patients aware that there are other options for straightening teeth. Kate King reports.
There is a new wave of thinking in the world of dentistry.
Orthotropics have been outstanding for my children. They don't have asthma, they did have asthma. They don't snore, they did snore.
Orthotropics is a way of improving the teeth by reshaping the jaw. So why is it being shunned by the New Zealand Association of Orthodontists?
Sadly, with regard to orthotropics, the so-called orthotropics I should say, is that there is no evidence. The work has not been done.
There are 82 registered orthodontists in New Zealand, but not one of them offers orthotropics. Orthotropic treatment is focused on changing the posture of the jaw and expanding it to fit all 32 teeth. Specialists use an appliance which is put in the roof of your mouth to gradually manipulate the jaw.
This is with the traditional orthodontics telling me, can't do anything, break his jaw at 18.
Anne Gazer's children have used both systems, and she swears by orthotropics, but she found it through her own research. It was never recommended by her orthodontist.
Whether they think it works or it doesn't work is actually not for them to make that decision. It's up for me. I'm the client. Whatever issue they have within the industry, they can at least say there is a new wave of thought out there. Go and have a look at it. Once you've informed yourself, come back and we'll discuss.
So if a patient comes in here and they said, look, tell me what I can have, what options I have,
yes,
you wouldn't recommend it? You wouldn't put it on the table?
No, I wouldn't put it on the table. It's not responsible for me to do so.
So if you could just help me a little bit, I'm just looking round.
John Muir is the man who patented the appliance that's key to orthotropics. He claims orthodontists in New Zealand simply don't want anyone challenging their traditional use of braces, or train tracks as many people call them.
If a face is growing unattractively, you can make a huge difference with orthotropics, whereas with the fixed train tracks, as they call them, you can make very little difference to the shape of the face.
The orthodontists prefer what they call a straight face. I like a full face with the front part of the face further forward.
The Orthodontic Association repeatedly told me there is no scientific evidence to prove orthotropics works. But John Muir has written several peer-reviewed articles and conducted this study involving twins.
Although Ben and Quentin Creed are identical twins, their treatment wasn't. Like tens of thousands of other British children, Ben had 4 teeth extracted and the rest braced. Quentin, on the other hand, was treated by John Muir without extractions. Instead, he used a technique designed to expand his jaw to make room for the teeth.
When the study concluded at the age of 20, both twins agreed Muir's treatment worked better. But in 2007, John Muir was kicked out of the British Orthodontic Society for criticising his colleagues.
Sadly to say, the majority of faces look worse after the traditional orthodontic treatment. Now, they will be very angry with me for saying that, but I would simply say, well, give me any evidence to challenge that with.
No, that is not true. That just simply is not true. You'll find that all orthodontists may treat people somewhat differently. No two people have the same sort of facial features, and it is not desirable to try and create the same sort of face in everyone.
Nick Anderson runs one of New Zealand's largest dental practices. His clinic's one of the places providing orthotropics, and he can hardly keep up with demand.
We're seeing sort of 90, maybe even 100 patients per day having this treatment done. We treat a lot of people from around the country that will fly in to see us.
But the catch is, he's a general dentist offering what is essentially an orthodontic treatment. And the Dental Council is now proposing a rule change that would stop Nick from advertising that he practices orthotropics.
I just think because it's different and it challenges their views, it challenges the way they treat their patients. which would be probably pretty scary, because it's, if you felt that you weren't doing right for your patients, it's a hard thing to swallow.
So if Nick Anderson can't advertise about it and orthodontists won't give information about it, how can patients make a choice?
Does there need to be some debate about this in New Zealand, or are you just completely ruling out the idea of orthotropics?
We will not really recommend it to our patients until we see some evidence.
So does there need to be a study undertaken in New Zealand?
Yes, of course.
Is that something you're looking into?
Not me personally.
So while orthodontists and orthotropists remain so far apart in their beliefs, it's unlikely parents like Anne Gaze will get exactly what she wants.
That's all we ever want as parents, is to be informed. We're big enough and ugly enough to make our own decisions as to where our money is going to go and what is good for our children. But when somebody selectively denies me the right to be informed, I have huge suspicions, and I think personally it's professionally negligent.